Good morning, everyone. Welcome to our Regional Geriatric Rounds webinar. My name is Alan Huang, and I am the Medical Director of the Regional Geriatric Program of Eastern Ontario, and I will be the moderator for today's session. Before we begin, we would like to take a moment to share a territorial land acknowledgement for Ottawa, where we are hosting today's session. The RGPEO offices hosted at the Ottawa Hospital are located on the traditional unceded territory of the Algonquin and Anishinaabe Nation. The Algonquin people have lived here since time immemorial. We are grateful to have the opportunity to be present in this territory. Today, Professor Alison Chasteen will be presenting on ageism's influence, how older people are viewed and view themselves. To note, during the webinar, questions can be asked using the Q&A button or the chat room to be answered during the Q&A time at the end of the presentation. So by way of introduction, Alison Chasteen, PhD, is a professor in the Department of Psychology at the University of Toronto. Professor Chasteen is a social psychologist with specialized training in aging and cognition. She is one of the foremost experts on stereotyping, prejudice, and stigma within the context of aging. With funding from the Social Sciences and Humanities Research Council of Canada, the Natural Sciences and Engineering Research Council of Canada, and the CIHR, she has over 80 publications that span outlets in social and cognitive psychology and gerontology. She is the principal investigator of the Intergroup Relations Lab and is a member of Team 17 of the Canadian Consortium on Neurodegeneration and Aging. Professor Chasteen is a fellow of the Association for Psychological Science, the American Psychological Association, and Gerontological Association of America, and the Society for Experimental Social Psychology. Welcome, Dr. Chasteen. Thank you for joining us this morning to share with us your expertise.
Well, thank you very much, Dr. Wong. It's a pleasure to be here and to join all of you today. Before I begin, I also wish to acknowledge the land on which the University of Toronto operates. For thousands of years, it has been the traditional land of the Huron-Wendat, the Seneca, and the Mississaugas of the Credit. And today, this meeting place is still the home to many Indigenous people from across Turtle Island, and we are grateful to have the opportunity to work on this land. Okay, so as my title of my talk indicates, I'm happy to share with you today some research that we've been doing, trying to understand ageism's influence, both on how older people are viewed by others and also on how they view themselves and what the role of ageism is in that. As the introduction noted, I take a social psychological perspective to understanding ageism's influence. In particular, my lab is interested in stereotyping and prejudice, and we investigate stereotypes and prejudice both from the perceiver's perspective, that is those that have or hold stereotypes about different groups and apply them, as well as we investigate the target's perspective, that is those who are the object or the target of stereotypes and prejudices. And in my intergroup relations lab, we look at stereotyping and prejudice towards a variety of different groups, including biases and stereotypes based on race, on gender, on sexuality, and of course on age, which is what I'll be focusing on today with you. Now, before we get going, I thought it would be important that we start from the same conceptual foundation, and I'd like to share a definition of ageism with you. For today's purposes, I thought it would be good to come from the definition that was developed by the World Health Organization, which has a relatively broad definition of ageism, and they define it as the stereotyping, prejudice, and discrimination against people on the basis of their age. And according to the WHO, ageism is one of the most socially normalized prejudices. Now, we've all been hearing perhaps a bit more about ageism in the last couple of years during the pandemic, and media coverage of different manifestations of ageism, particularly against older people, in a variety of spheres of life have been covered. And we've also seen in the academic sector a number of editorials and commentaries talking about ageism and the need to reduce biases and prejudices against older people and to reduce intergenerational tensions. But this last headline or title I put at the top here, it says there's nothing new under the sun. I put there intentionally because I did want to point out that ageism has existed for quite a long while, many, many decades. And in fact, the term was first coined by Robert Butler in 1969. And indeed, if we look at this word cloud, this represents some data that was published well before the pandemic. In this case, this data comes from Australia, but you see similar types of findings around the world that has looked at media portrayals of older people. And what you can see here is some of the most common words or stereotypes associated with older people in media portrayals are words like forgetful, frail, vulnerable, lonely, slow, victims, and so forth. And those types of themes have existed for quite a while in terms of being components of stereotypes of older people and of aging. Now, where I'd like to take us today in our investigation of ageism is to look at a few different questions. One is to look at the question or consider the question, how are ageist acts viewed? And for this, we'll take a look at some data I published recently investigating how perceptions of appropriateness or inappropriateness are made about different kinds of ageist acts. Next, we'll consider how is ageism experienced. And for this, we'll look at some data we collected with older people and asking about their ageism experiences. Next, we'll consider, well, what are implications of ageism, in particular for self-perceptions of abilities among older adults, their feelings of subjective age, that is how younger or older they feel, and also implications for self-esteem as another indicator of well-being. And then lastly today, we'll take a look at what we might be able to do to try to challenge ageism and reduce age stereotyping. Before we get started understanding ageism a bit more, I think it's important to first talk a bit about where these age prejudices come from. And they really come from the age stereotypes that people hold about older people and the aging process. And there's actually two different categories of age stereotypes that exist. One is descriptive age stereotypes. That is the stereotypes we use to describe older people, excuse me, and aging. And for descriptive age stereotypes, they're relatively complex because they consist of both positive stereotypes, such as being a golden ager and a nurturant grandparent, but they also consist of negative stereotypes, such as experiencing cognitive impairments or physical frailty. And research has shown that these positive and negative descriptive age stereotypes are shared by young, middle-aged, and older adults. So all across the adult lifespan, people share similar perceptions of older people and of aging. Now, in addition to descriptive age stereotypes, there's another category of age stereotypes that have been found to exist, and those are prescriptive age stereotypes. So here we're talking about prescriptions or expectations people hold for how older adults should behave. And these have been found to exist along three different domains. One is in terms of identity. So here the idea is that older adults are experiencing prescriptions about how they should act their age. And as this cartoon depicts here, what this thought bubble of this character in the cartoon is thinking is, what is this older woman doing in this cool, hip, younger cafe? Why is she using technology like a laptop and being on a cell phone and so forth? She's not acting, quote, her age. Another prescription that involves age stereotypes is with respect to succession, that older adults should get out of the way and make room for younger people or younger generations. And that's characterized by this bubble in the middle, where this younger man is thinking about this older worker it's time for him to step aside and make room for the younger man's generation to acquire these positions of employment. And then the last prescriptive age stereotype has to do with consumption and the perception that older adults are taking more than their fair share, either in terms of most commonly healthcare or in terms of, for example, pensions. So all of these different kinds of stereotypes help to underlie the biases and forms of ageism that we see expressed towards older people. So that leads to the first question I wanted to ask today, and it circles back a little bit to that point I made earlier that the World Health Organization suggests that ageism is one of the most socially accepted forms of prejudice. And so we wanted to investigate this a bit more and ask, well, how are acts of ageism viewed? Now, we asked this in terms of perceptions of two specific forms of ageism: benevolent ageism, which is characterized by warmth, warm overtones and so forth, but also is characterized by condescension and patronizing behavior towards older people. And that's in contrast to hostile ageism, which is more when I think people think about prejudices, they tend to think about hostile forms of prejudice towards different groups, including older people. So, verbal and potentially physically abusive and characterized by hostility and coldness. So we wanted to see how different kinds of ageist acts that vary in being benevolent or hostile are viewed. And also we wondered if these perceptions of these ageist behaviors would vary in terms of who is perpetrating these acts. So we varied the degree of closeness between the older adult target of these behaviors and the perpetrator. So whether, for example, it was a family or friend who was engaging in these behaviors, or, for example, a stranger. So in this study, we had 424 young, middle-aged, and older adults rate the acceptability of 30 different benevolent and hostile ageist acts. So an example of some of these would be, excuse me, for hostile, calling someone an insulting name related to their age, or benevolent, using simple words when talking to older people so that they can understand more easily. And then we also varied who was perpetrating these acts. So you can see in the upper left, they evaluated these acts when they were committed either by younger family members, such as children or grandchildren, same-age family members, such as spouse and siblings, familiar service workers. Those would be people that older people interact with regularly, but are not related to or in a friendship with. And then unfamiliar service workers. So these would be people that older adults engage with, for, say, a first time and are not familiar with these individuals. So we wanted to see how evaluations of these acts might vary depending on whether they're benevolent or hostile and who is committing the act, someone who's relatively close to them or relatively distant. So what we found here is that you can see these are ratings made by young adults, middle-aged adults, and older adults in our sample. And a pattern is pretty clear across all three groups in that all three groups rated the benevolent acts as more acceptable compared to the hostile acts. And there's, pretty good consensus among the three age groups on that. There was a little bit of an age difference when it came to hostile acts. You can see the young adult, the green bar for them is a bit higher than it is for middle-aged and older adults. So younger adults thought that hostile ageist acts were significantly more acceptable compared to middle-aged and older adults, but still overall less acceptable compared to a benevolent ageist act. Now, in addition to finding this difference by the type of ageism, we also found that the closeness of the perpetrator did matter. So again, you can see here on the left that the benevolent acts overall are rated as more acceptable than the hostile acts on the right, but there's also some nuance to those findings. And you can see here on the left that with the benevolent acts, for example, when they're committed by a same-age family member, such as the green bar, they're rated as more acceptable than when they're committed by someone who's an unfamiliar worker or a stranger to the older adult. And that same pattern holds over on the right for the hostile ageist behaviors as well. So it seems to be the case that not only does the type of ageism matter in terms of how we view the acceptability or unacceptability of these behaviors, but it also seems to matter that we consider who is engaging in these behaviors, who is the transgressor. So just to summarize, We found that benevolent ageism was viewed as more acceptable than hostile ageism, and that the acceptability of both kinds of ageism varied by the type of relationship, whereby ageism from same-age loved ones, such as family members and friends, was the most acceptable, but ageism from unfamiliar workers was the least acceptable. Now I'd like to go on to the next question we're going to consider for today, and that is, how is ageism experienced? And here we're going to focus on the experiences of older adults, and we had a sample of 235 older adults complete a survey in which they described an ageism experience, and then we coded those experiences for the domain, life domain in which they occurred, who was the perpetrator of the ageist act or the transgressor, and then also what was the experience type, how was this ageist act manifested. So in terms of the life domain in which older adults reported experiencing an ageist event or an ageist act, the most common one that they reported was when receiving goods and services. And then the next most common was in the workplace. So because many of our older adults were still young enough to at least be working part-time or doing consulting and so forth. And they were also free to recall acts, from in the past, not even necessarily very recently. And then they also reported experiencing it in public spaces and also in social situations. Now, in terms of the perpetrators of these acts, they largely mapped onto the domains that I just showed you. So, for example, the most common transgressor of an ageist act was a service worker, followed by a stranger, and then by employees or coworkers, and then lastly by friends or family. And then in terms of how these ageist acts were manifested and sort of type, experience type, we found a few different themes to the type of ageist expressions that were made. The most common that older adults reported experiencing had to do with assumptions that were being made about them, either in terms of their social aspects about them, such as, say, their values or their beliefs that people were assuming they had based on their age, or physical assumptions, such as about their physical abilities, and also taking their physical appearance as a cue to make assumptions about them. They also reported experiencing unwanted help or special treatment that they were not seeking out and did not desire. And then lastly, they talked about experiencing a lack of respect as another type of ageist act that they most commonly experienced. So just to summarize, in terms of domains, we found that the most frequent domains that were in which ageism was occurring was when receiving goods or services, followed by public spaces and also workplaces, and that the perpetrators were largely congruent with those domains, such that they tended to be service workers, strangers, or co-workers or employers. And then in terms of types, we found that assumptions were the most common types of ageist acts that were made towards older people, either regarding physical or social aspects about them, or imposing unwanted help on them, or engaging in showing a lack of respect towards older people. So one of the things that I wanted to consider with you then is, given some of these findings we've seen so far today, and the stereotypes that we've talked about today, it's important to also then consider, well, what does this all mean for people's views of aging? What are the implications of these ageist treatments and these stereotypical portrayals for how people view aging, and in particular, older adults? And as this image conveys to you, we have a lifetime to develop our views of aging from childhood onward. And in fact, Becca Levy, in her stereotype embodiment theory, talks about the idea that age stereotypes and ageist treatment of older people can become internalized in all of us. So for example, from a young age in childhood, we're exposed to a variety of age stereotypes in various forms of media, like I suggested earlier today. But also we can witness ageist treatment, say, of older people around us, whether in our families or out in the world. So all of these different sources of age stereotyping and seeing ageism being applied can come to become internalized within us and affect how we view aging and older people. And we may not really think about doing much about it because as younger individuals, we don't really think about the fact that we're not part of that older adult group yet. So we may not be motivated to sort of combat or fight against these stereotypical portrayals and ageist behaviors. And so they can start to be internalized in us and influence how we think about aging and older people. And then one day we've come to find ourselves to be older ourselves. And this could then have potentially a negative impact on how we experience aging, what our expectations of what aging should be like, how we view ourselves as older people and our fellow older adults around us. So it's really important to think about how ageism and age stereotypes should be addressed, because in Becca Levy's theory of stereotype embodiment, this internalization could really come back to haunt even ourselves when we become older. And in fact, she and others have shown that aging stereotypes and having negative views of aging can have detrimental consequences for older people. So for example, in some of her work and others, it's been shown that if you activate negative age stereotypes in older people, that is, you get them to think about these negative age stereotypes, like I've shown you today about physical frailty or cognitive impairments or being slow and frail and so forth, that can actually lead to elevated cardiovascular responses. It can also lead to impairment of motor performance. And lastly, it's been shown in a number of studies as well that getting older people to think about the content of these negative age stereotypes can then afterwards impair memory function when they're tested for their memory on different types of tasks. It's also been shown that in terms of views of aging, when older adults have more negative views of aging, they tend to experience more hearing decline, and also they're more likely to experience worse health in later life. Now, I'm not going to go through this whole model with you, so don't worry, we're not going to dig too deeply into the structural equation model, but I just wanted to share with you some of these findings from my own collaborations in terms of the implications of having negative views of aging for the well-being of older people. So in this study, what we did was we measured older adults' negative views of aging. And just what I want to highlight to you here is that we found with these two circled sets of numbers here in the light blue circles, we found that the more negative that older adults' views of aging were, that was tended to be associated then with lower or worsened self-perceptions of abilities with respect to memory and hearing. So once again, just to state that again, the more negative those views of aging were, then the lower their self-perceptions of their abilities with respect to memory and hearing were found to be. And that was important because we also found that those self-perceptions of abilities with respect to memory and hearing were predictive of their actual memory performance and hearing performance. So those self-perceptions of abilities really matter because they can feed forward and influence actual performance in these domains. So this suggests then that older people's negative views of aging can indirectly, or they can directly predict self-perceptions of abilities in two different domains, a sensory domain of hearing and a cognitive domain of memory. And then those self-perceptions can go on to predict actual performance, which obviously can have implications for the well-being of older people down the road. In some other work, we've also taken a look at some other forms of well-being and how they can be affected by age stereotypes and age prejudices. And here we've taken a look at subjective age and also at self-esteem. Now, when we talk about subjective age, what we're talking about is people's feelings of being subjectively older or younger than their chronological age. So as this picture shows here, this image, this older man, when he looks in the mirror, he doesn't necessarily see himself as an older man, but he can see that younger self he once was, or he can see that he feels still younger than his actual chronological age. He feels younger than his years. And research has suggested that maintaining a younger subjective age can actually be associated with a lot of beneficial outcomes in terms of health and well-being and so forth. So we wanted to look to see if these feelings of subjective age can be affected by negative age stereotypes and age prejudices. So what we did was we measured older adults, excuse me, self-reports of perceptions of age discrimination and age stereotypes, as well as their subjective age and their perceptions of their own aging. And here's what we found. Again, we won't get too much into the statistics here, but what I want to share with you is, again, in that blue circle, what we found is that the more negative these age stereotypes were that they encountered, or the more age discrimination older adults were perceiving, then the worse were their self-perceptions of aging. So they didn't have then good views about how aging was going for them. And self-perceptions of aging went on to predict how young or old that they felt. And in fact, the more negative their self-perceptions of aging were, then the older they reported feeling in terms of their subjective age. And then subjective age went on to predict self-esteem. So the older that older adults reported feeling subjectively, then the lower were their self-esteem ratings. So worse well-being for those who felt subjectively older. And then there was also a relationship from having negative self-perceptions about their aging process to self-esteem as well. So feeling worse about how aging is going, having worsened self-perceptions of aging was associated with lower self-esteem. So taking all this together, this suggests that having or being exposed to, I should say, these negative age stereotypes and perceiving age prejudices or discrimination against older people can actually ultimately lead to worsened well-being in the form of subjective age and self-esteem. So these all suggest that there can be pretty serious implications of being exposed to ageism and age stereotypes. So just to conclude so far, what we can take away from what we've talked about today at this point is that ageism is prevalent and can take benevolent or hostile forms. And of course, we found that benevolent ageism was more tolerated than hostile ageism. And also that ageism experiences can occur in a variety of life domains and be perpetrated by a variety of transgressors. And here again, we found that assumptions being made about older people are some of the most common, as well as experiencing a lack of respect. Also, ageism can have negative implications, which we just took a look at for a variety of aspects of well-being, including some of the data I shared with you from my collaborations in terms of implications for self-perceived abilities, subjective age, and self-esteem. And then what I want to do next, after having established what some of these patterns about ageism and age experiences are, is to have us consider for a moment, well, how can we go about challenging ageism and age stereotypes? So in terms of challenging ageism and age stereotypes, I want to look at two different routes through which we can do that. One is to try to improve views of aging through education that challenges ageism and age stereotypes. We'll take a look at two educational initiatives that are being undertaken to try to do this: the Aging Plus program and the Reframing Aging initiative. And then also I'll share with you some data from my lab where we've been looking at what happens if you actually confront ageist behavior. Does that help to set new norms about what is acceptable or unacceptable in terms of ageist acts? Sorry. So in terms of one of the educational initiatives I'd like to talk a little bit with you is the Aging Plus program. And this is being undertaken by one of my colleagues in the field, Dr. Montford Deal at Colorado State University. And he's currently conducting an intervention study funded by the NIH to understand how an educational type of workshop, which they developed called the Aging Plus program, can be, whether that's successful in improving older adults' views of aging. And then they're also interested in physical activity outcomes as well. But here, what I wanted to share with you was some pilot data that they first published before undertaking the full clinical trial. And what you can see here is in the light blue bars, these were measures taken at baseline before older adults were enrolled and went through their Aging Plus workshop. And then the darker blue or sort of purpley bars are 12 weeks later after the start of that program. And what you can see here is that in terms of viewing aging as an opportunity for gains, they saw an increase in expected gains with aging on the left. In terms of the middle finding, in terms of older adults' views of aging in terms of losses, their perceptions of aging involving, primarily losses went down. And then overall on the right-hand side, in terms of their expectations about aging in general, those became more positive after going through the Aging Plus program. So this is an example of how an educational intervention workshop can be effective in starting to change older people's views about aging and help to reduce or counteract the effects of age stereotypes and ageist treatment. A couple of educational campaigns that are going on are the World Health Organization, which is the image on the left and the website address at the top of the slide. Last year, they published a global report on ageism, and they're currently doing a very broad campaign of trying to educate people about ageism in terms of globally, and also encourage initiatives to be undertaken at different levels, whether it be at sort of the structural, governmental public policy level, more at sort of a local level, or even at the individual level to try to reduce age stereotyping and ageism. And it's a really terrific report. So if you're interested, the website there is at the top, but you can also just, Google World Health Organization or WHO Global Report on Ageism. And it's a really terrific summary of findings on ageism around the world, as well as recommendations for ways to reduce it. And then also you can see on the lower right of this slide, the Reframing Aging Initiative. And this initiative is being co-sponsored by a number of different organizations, both in terms of the sort of scholarly or academic sector, such as the Gerontological Society of America, the American Sociological Association, American Psychological Association, and so forth, as well as organizations like the AARP in the United States, the American Association of Retired Persons. And what they're trying to really do here is to instill a new narrative about aging, to reframe how we think about aging and older people. And they've got some terrific toolkits and resources available as well, infographics and other kinds of toolkits. And one of their most recent initiatives is to try to promote more age-inclusive language, to change literally some of the language we use around aging and older people, to help to start to reframe the way we think about those, about aging and about older adults. So if you're interested in that, check out the Reframing Aging Initiative. It's another great resource. You can use those tools for your own initiatives. And the last thing I wanted to share with you today is some work we're doing in my lab, in which we're trying to understand, well, what happens if older people confront an ageist behavior? Can that help to set some new norms about the acceptability or unacceptability of ageist behavior? And so we wanted to take a look at what happens if older adults reject versus accept unwanted help. Now, you'll recall earlier today, unwanted help was one of the types of ageist acts older adults reported experiencing. So this example here with the crosswalk image of an older woman preparing to cross the walk would be, perhaps an ageist act would be if someone insisted on, taking their arm and helping her across the street, whether she had asked for it or not. So that'd be an example of unwanted help. So we wanted to investigate how would an older person be perceived if they rejected versus accepted this form of ageist act. So we had participants read about an ageist act from an unfamiliar individual. So it was a stranger, where the stranger engaged in sort of forcing unwanted help on the older adult in terms of insisting on taking her across the street. And they either did so in a sort of benevolent, kind of condescending way, or in a more sort of hostile, kind of aggressive way, kind of an impatient way. And then we also varied the older female target's reaction to this behavior, where she either engaged in a confrontation where she moderately, but politely rejected this behavior, or more strongly rejected or confronted the ageist behavior, or she reluctantly accepted the behavior. And we also investigated what difference her reaction made in perceptions of these behaviors and on her. And so we collected ratings of the perpetrator as well as the older target, both before people learned about the older target's reaction to this behavior and then afterwards. Now, we looked at a number of different outcomes for this, but I'm just going to share two with you today for the interests of time. So first, we looked at the appropriateness of the perpetrator's behaviors. So this is kind of similar to what I shared with you earlier today. And on the left-hand side are the ratings of the appropriateness of the behavior at time 1. So this is before they learn what the older target's reaction to the behavior is. So here, as you would expect, there were no differences across the 3 confrontation conditions because the confrontation hadn't happened yet. But what I wanted to point out to you is that in general, participants thought that these acts were relatively appropriate, being at the midpoint of the scale. Now, on the right-hand side is at time 2, after they've learned about the target's reaction to the ageist behavior. And again, the target can either accept, moderately reject or confront, or strongly reject or confront this behavior. And what you can see here is you do see a shift in people's perceptions of the appropriateness of the ageist act. And it went down and went on to be seen as less appropriate after the older adult moderately or strongly rejected that ageist act. So it does seem to be the case that confronting ageist behavior can start to shift people's perceptions about the appropriateness of these ageist acts. Now, what about the consequences for the older adult herself? One of the things that we took a look at was what was the perceptions of her competence. And on the left-hand side are perceptions of her when she was a target of hostile ageist acts. And you can see here that if she moderately or strongly confronted that hostile ageist behavior, she was then seen as more competent afterwards. On the right-hand side is when she was the target of benevolent acts. Oh, sorry, I wanted to say if she accepted the hostile ageist act, her competence was rated as lower after sort of giving into that behavior. And on the right-hand side is when she was exposed to benevolent acts. And you can see if she moderately confronted it, she was seen as more competent afterwards. But interestingly, if she strongly confronted that benevolent act, then she was seen as less competent after strongly rejecting the benevolent ageist behavior. So what are some things we can take away from this study? One is that reactions to ageism can influence perceptions of the appropriateness of the act. So how an older adult responds to this ageist behavior can have a consequence for how we view the ageist act. Also, we found that moderate confrontations of ageism can actually improve perceptions of older people's competence. And that may help to reduce age stereotypes about older people as being lower in competence. But we also found that strong confrontations might be seen as disproportionate to the ageist act. So you'll recall when it was in response to a benevolent act, it actually led to a worsening of perceptions of an older person. So it suggests that when we think about confronting ageism, particularly for older adults wanting to confront ageism, it might be the case that a moderate approach might be a better way to go in some situations compared to, say, a stronger rejection or confrontation of that ageist behavior. So I just want to leave you with some final thoughts for today before we finish and go on to questions. One is that age stereotypes and ageism are prevalent and do affect our views of aging. Another is that how we view aging really does matter. It can influence our sensory, physical, cognitive, and emotional well-being. And of course, we can develop these views of aging across a lifetime. So it's important that with all these exposures to age stereotypes and ageist treatment of older people, that we start to think about counteracting those in terms of, debunking some of these negative age stereotypes, for example, and rejecting ageist behavior aimed at older people. And that then leads me to my next point, that interventions to challenge ageism and improve views of aging are being developed, as I showed you today, but more are needed every day, right? We have only shown you some of the broad initiatives, but there's many things that could be done at more local and regional levels. And lastly, I think we should keep in mind that viewing aging less through the lens of age stereotypes can actually open us up to more opportunities as we grow older. So if we can reject these age stereotypes and think about ways that we can improve our own aging experiences, it can open us up to considering more opportunities for ourselves later in life. And to close here with this quote from the late David Bowie, aging is an extraordinary process where you become the person you always should have been. So I just want to thank you for your attention today and acknowledge some of my collaborators, including Michelle Hrohoda at Furman University in the United States, Manon Marquet at the University de Liège in Belgium, Kathy Pecora Fuller at UT Mississauga, and Jason Plax at my home campus, UT St. George, my Intergroup Relations Lab, and the funding agencies that contributed to this work. Thank you very much.
Thank you, Dr. Chasteen. As we move to our Q&A time, just a reminder for the audience participants, please use the Q&A button to ask your questions. And if you cannot find the Q&A button, you can use the chat room. I guess, Dr. Chasteen, I'm just going to take the moderator's prerogative to toss out an idea or a question to you. Sure. And the ageism problem, is it universal across all cultures?
Yeah, so you can see in the UN report, because they've looked at that cultural variable kind of from a more meta-analytic across many studies type of question. And we do see ageism manifesting in a variety of cultures. Earlier in sort of the earlier lines of research investigating potential cross-cultural differences in ageism suggested that perhaps in some Eastern cultures, you would see, because of filial piety or the expectation that younger generations should respect older generations, that you might see reduced age stereotyping in ageism. However, later studies have gone on to show that's not necessarily the case, that actually sometimes, depending on how the data is collected, say in private confidential assessments, you might actually see greater resentment from younger generations towards older generations because of this filial piety expectation. And also there's been a suggestion that because of the westernization of many parts of the world, we see, the exposure to these media portrayals of older people in stereotypic ways that then, reach further around the globe and can affect perceptions of older people and aging. So the global report on ageism suggests that we really do see a lot of age stereotyping and ageism going on in many different countries.
Thank you. So now I'm going to start reading you questions in the Q&A
Sure.
Chat box. Do you consider ageism to be an equity issue? I have heard different viewpoints on this, given the fact that everyone ages versus not everyone is part of a certain racial group, for example.
It's a great question. I absolutely do think that ageism falls under that umbrella. And in fact, if you think about the Reframing Aging initiative as one example of that, they're trying to promote more age-inclusive language. And if you think about it, in our society, we really have, in many ways, a lot of age segregation going on, where older people aren't necessarily feeling welcome or able to, perhaps because of the actual, physical geography of a landscape or buildings in terms of access and things like that, to enter into some of these spaces and participate in some public spaces the way that younger age groups can. So we do see a fair amount of age segregation in terms of where age groups are living and maybe not interacting as much as would be possible if we thought about how to promote age inclusivity. And that goes in both directions too. How can we improve age inclusivity for younger age groups in different spaces as well?
Okay, thank you. The next text comes from Kathy Blomquist, who has a comment and a question. And she says, I have a New Horizons grant to work with older adults and high school students to address ageism. Great resources you've provided focusing on the older adults. I understand the principles can be the same, however. Can you direct me to resources specific to youth?
So is she interested in reducing youth ageism, or is she interested in materials for young people to change their perceptions of older people? Just to clarify. I don't know if she can quickly.
Yeah, I invite Kathy to go online and.
It's okay if she can't get to the mic. I'll answer both. So there's some research coming out now about youth ageism, that is ageism directed at young people. And I don't have the citation handy in my mind, but one of my colleagues in the field, Dr. Michael North, who's at New York University, published a paper, I think it was in Journal of Personality and Social Psychology. And if Kathy would like to email me afterwards, I can try to dig that reference up for her if she's interested in learning more about ageism aimed at younger people. And we also, I didn't share this data with you today, but we collected ageism experiences of young and middle-aged people, and there were definitely ageism experiences in both of those age groups as well. Now, in terms of materials aimed at younger perceivers to try to reduce their age stereotyping of older people, I don't know of materials that have been developed specifically, say, for high school age, but I would encourage her to first check out some of these toolkits that the WHO and Reframing Aging Initiative have developed and see if those are a starting point. I suspect they might be quite useful even for high school age, and maybe just that can be a starting point to then think of examples that can be generated for high school individuals to think about in terms of how ageism creeps into their daily lives and their encounters with older people.
Thank you. Next question comes from Jen Coop. We are building a care pathway for patients with dementia in acute care in order to identify risk factors for decline and iatrogenesis in hospital. We are asking clinicians to be more aware of age-related issues and take a preventative approach. How do we ensure that we don't swing the pendulum too far by overemphasizing decline due to aging and reinforcing ageist views in an attempt to have early identification and prevention of poor outcomes for older adults in hospital?
Yeah, it's a tough question because you want to educate and improve sensitivity to signs of different types of conditions developing in older people and later in life, but you don't want to heighten this concern that gets older people to be constantly monitoring for signs of cognitive impairments and onset of dementia and so forth. I think that the pathway to take is to really try to promote healthy aging. And I don't like to really use the word successful aging because it suggests that there's like this one winner take all way to age. But if we can really try to get people to think about how can they promote a healthier aging experience, that would include, really, doing things like going to regular checkups. And in the CCNA group, Team 17 I'm part of, they're focused on sensory, especially hearing and vision. So also making sure you're checking on your sensory, your vision and hearing abilities. Are they where they should be later in life? Are you able to communicate as well as you were earlier in life? And if you're having problems in those areas, to then seek out help and supports and diagnostics and perhaps hearing aids or vision aids to improve your ability to communicate and so forth. So I guess I try to view it more as taking a multi-pronged approach to try to maintain health and have a healthy aging experience as much as possible.
Thank you. The next question comes from Dr. Azad. Can you also comment on gender and socioeconomic aspects of differences in ageism?
Great question. And that's actually something we're just starting to be able to consider now. We've done some of this basic work looking at age as sort of this single category. One of the things with one of my newest graduate students and I, she's starting out in her first project, is to look at the intersectionality of age with, say, race and also gender, to try to understand how is ageism, is it, first of all, expressed differently to different groups of older adults. So, for example, our older adults who come from communities of color, are they experiencing ageism differently than white older adults, as an example? And again, male older adults compared to female older adults. Do we see differences in these ageism experiences? There's not a whole lot of data on that yet in terms of uncovering these experiences by those different group memberships, but that's definitely something we're taking a look at as well as others. I would suspect that some of these other, some of the literature would suggest that when you have intersections with different group memberships that are stereotypes, so say being a member of a community of color, or being a woman, or being from a lower economic status group, that, all these groups experience stereotyping on their own. And then when you combine that with age, there's been some suggestion that you might see greater ageism and stereotyping when you have these intersections. But honestly, there's not a lot of data on that yet, and we need to take a look at that more.
Thank you. And while waiting for any other questions in the Q&A chat box, I'm going to bring up another issue. And Louise Aronson, who's a geriatrician in San Francisco, published a book called Elderhood, in which it's sort of semi-autobiographical, and it describes a geriatrician in the American healthcare context, and the fact that as people age, they become invisible to society. And her book has actually made it to the New York Times bestseller list. What do you think about literature influencing social views? Does it work? Can it work?
Well, in this case, I think what I haven't read that book yet. I need to, clearly. But the theme of invisibility is actually something that we see with a number of different kinds of stereotyped and stigmatized groups. And age is certainly one of the categories that people report experiencing invisibility. So in terms of this book addressing that type of theme, I think that's really useful, because it gets us to think about, well, why aren't older adults considered more? And going back to this idea of age inclusivity, how are older adults being excluded from, our daily lives and from our discourse on a variety of issues, and how are their perspectives not being considered? So I think it's helpful, again, in this effort to increase awareness of ageism and how it's being manifested in different ways.
Thank you. Heather, anything in the chat that should be brought forward?
I just had a couple questions because I can't type in the Q&A. So one question I had was, I was intrigued by the results from the strong confrontations to ageism, resulting in, it sounded like, more ageism or a negative result. Are you seeing that same result across the other prejudice that you investigate?
Right. So there has been suggestions when people are confronting other forms of biases. So we have some data, for example, in my lab, looking at confrontations of anti-gay comments. And we do find that the most strongest form of confrontation against that kind of bias. So here, this would be like a confrontation that would say, label the anti-gay comment as homophobic, and being very aggressive towards the person who made the comment and telling them to, shut up. That's not okay to say that. That kind of comment, very, very strong confrontation, is also not received particularly well, is not perceived well. So that data in the context of of anti-gay comments and confronting those, we again find that these more moderate approaches seem to be the better route to making the point, but not alienating those around who witness the interaction.
Good, thank you. And I had one last question. So on a, I would say, daily basis, clinically, I encounter the ageist attitudes from caregivers, from older adults, and from other healthcare practitioners, sort of indirectly. And that's specifically around accessing healthcare. So we hear it in the comment like, well, what do you expect? You know, my mom's 84. Or when I'd ask the older adult, well, did you, bring up that concern with your family doctor? And they would say, well, he just said, or she just said it's old age. So your fabulous presentation provided a lot of key information as to why perhaps we're seeing this. So I was just wondering, is there anything in your research findings that has surprised you?
Well, I guess I was pleasantly surprised that these moderate confrontation tactics seem to reduce the social costs for older people of speaking up and rejecting at least this one particular type of ageist act, which was this unwanted help. Because the realm of benevolent ageism is really tricky, because as I stated earlier in the talk, it's characterized by an overtone of seeming warmth and caring and compassion, but at the same time is undermining the competence of the older adult who's experienced it, questioning their ability to do things themselves and treating them in a condescending way. And so it's a very complicated or complex kind of prejudice to try to counter it. And so I wasn't sure how well any sort of confrontation tactic would work. And so I was encouraged to see that a moderate approach of saying, thank you, but I've got this, I can handle it myself, seems to get the message across, but also not lead to negative views of the older person who's standing up for themselves. So that's definitely an area I want to explore further and look at other ways that benevolent ageism can be manifested, other kinds of behaviors, and then again, testing to see if this moderate kind of tactic of confronting or rejecting that behavior can change perceptions of the ageist act again, and also preserve positive perceptions of the older adult.
Well, thank you very much. Well, I think what I'm going to do is bring this session to a close. And once again, thank you, Dr. Chasteen, for an informative presentation. And thank you, everyone, for joining us today. And on screen, you see the upcoming next regional rounds on May 16th with the topic unintentional weight loss in older adults. And that will be presented by one of our former colleagues here in Ottawa, Dr. Christine Kim. And on June 20th, Pathogenesis and Therapeutics for Alzheimer's Dementia, a brief overview of current state of understanding and emerging perspectives, presented again by a former colleague here, Jamal Depradine. Another reminder, Geriatric Refresher Day will be on June 15th and 22nd in a virtual format for those sessions. And thank you everyone for attending today's webinar.